Pfizer's COVID-19 vaccine could become available for younger teens as soon as next week. So some Kentucky healthcare providers are getting ready to give the shot to preteens at the moment. LEX 18's Evelyn Schultz spoke with a pediatrician about their plans and what families should know before signing up. That's tonight's big story at 11.
When the FDA grants emergency authorization to Pfizer's vaccine for 12 to 15-year-olds, Dr. Beth Hawes says Commonwealth Pediatrics will be ready.
This is kind of our bread and butter. You know, we're used to keeping things at certain temperatures. We're used to documenting lot numbers. We're used to rotating our expiration dates and making sure things aren't expired. That's what we do every day. That is so automatic to us.
They're beginning with 100 doses and have already started adding families to a wait list.
We actually have around 90 families, so we'll be ordering more vaccine because some of those have more than one child. So that's wonderful.
It's also good news for the state's journey to herd immunity as vaccine demand slows down for other age groups in the Commonwealth. The Lexington pediatrician says they've already been vaccinating older teens. So far, CDC data shows almost 18,000 Kentuckians ages 16 and 17 have received at least one dose. Younger teens are up next.
Kids in Kentucky, it's about 20% of the population. So if we're working towards 70 or 80%, then that's a significant part.
Eric Green is a dad of two. He and his wife say they're eager to get their kids vaccinated as soon as they can. It could come soon for their 13-year-old.
Having my kids protected and us protected and the people I care for, that's what I want.
In Montgomery County, health officials also are preparing to vaccinate younger teens. Public Health Director Allison Napier confirmed they'll have 200 doses for kids 12 and up. Dr. Hawes says she understands many parents will have reservations about the vaccine, but she also says it's important for families to talk to their doctor if they're feeling unsure.
I would encourage people to get vaccinated, whether you'd be an adult or a child. If you have concerns, I would encourage you to actually speak to one-on-one to your physician or your nurse practitioner or a pharmacist. Talk to somebody and ask them your questions.
She hopes their answers will help make Kentucky a safer place for children.
Or whatever it takes to get us to immunity to where we can have a little bit more normalcy is probably the best thing for the kids in our community.
In Lexington, Evelyn Schultz, LEX 18 News.
Pfizer says they will ask for emergency use authorization for children ages 2 to 11 in September. They're still studying the vaccine's effectiveness for infants.